Jantina, usia, sosioekonomi dan kerjaya, daya upaya, pendidikan, bangsa, etnik, budaya dan agama. Perbezaan tidak sepatutnya menjadi penghalang dalam merapatkan jurang kesaksamaan antara kita. Halangan tercipta untuk dilepasi. Kita ada peranan dalam mengecap perubahan. Perubahan untuk merapatkan jurang penjagaan kanser. Bersama kita dapat menempuh jaya. Apa yang anda akan lakukan untuk rapatkan jurang penjagaan kanser?
Hello, selamat petang. Good evening. I am Dr. Gurpreet Singh from National Cancer Society Malaysia Perak branch. And then today we will be presenting about what we call as gallbladder carcinoma. So gallbladder carcinoma is pretty uncommon in Malaysia, but nevertheless, is something that is worth looking at it from a perspective of there are cases which are happening in in Malaysia as well. So we'll be going deep into this topic today. So please bear with me. And then we will be answering new questions and answers at the end of this topic. All right. So I am Dr. Gurpreet Singh. I studied in Gajah Mada University in Indonesia, and I also had done my postgraduate diploma in clinical psychology, but this was done online. But nevertheless, it's worth mentioning. So we will be exploring something regarding gallbladder carcinoma today. So we'll be looking at risk factors, diagnosis, treatment, and prognosis. Okay, so let's go into this. So first of all, we'll be looking at a few topics during today evening. So first of all, we'll start off with some introductions. Then we'll move on to some risk factors, clinical presentations, understanding gallbladder cancer by itself, diagnosing it, the treatment options that are available, prognosis, survival rates of gallbladder carcinoma, and then we'll be looking at what we call as TNM staging. I will be explaining to you what is called TNM staging in gallbladder carcinoma. And then we'll be moving forward to surgical approaches, therapies available, including some palliative care, the importance of having early screening in gallbladder cancer, the diagnostic procedures, and we should be understanding a lot of other risk factors. And I'll be diving deep a bit, not too deep, but a bit into biopsy techniques, diagnostic procedures which are available to diagnose gallbladder cancer today. We'll be looking at possibility of surgery as prevention as well. Just a bit on the surface, we'll be touching on it a bit. The treatment, prognosis, prevention of gallbladder carcinoma. So guys, let's and ladies, let's dive into this topic today. So gallbladder carcinoma, it's we have to have a look at hepatobiliary carcinoma overall if we want to dive deep into this gallbladder carcinoma. So it's the most common primary hepatobiliary carcinoma. It tends to spread to nearby organs and tissues. So gallbladder carcinoma, even though it can present by its own, on its own, but normally it does come with other spread. It does come from spreading from either from our biliary system or the liver itself. So we should be able to understand gallbladder carcinoma. We must be understanding what is cholecystolithiasis. So these are stones in your gallbladder. So frequent episodes of having stones in your gallbladder does put you at the risk of having gallbladder carcinoma. One of those risks. So it's directly related to increasing gallstone size. It's the amount, but it's also the size of it. So then we will dive into now what we call as the risk factors for having gallbladder carcinoma. So cholelithiasis, gallstones increases the risk of gallbladder carcinoma. This is already shown in this recent few years of our what we call as last few years of our research. So overall, they have come up that gallstones do have a direct relationship to gallbladder carcinoma. So the other contributing factors that we will be looking at it, diving back into cholelithiasis. So we'll be looking at 75 to 98% of patients with frequent cholelithiasis are prone to get gallbladder carcinoma. Other contributing factors are definitely old age. Females tend to have higher risk compared to male so far. And then chronic inflammations are also contributing factors to this situation. All right. So moving on, next, then we should be looking. And this is a graph, a pie chart, looking at. I mean, it looks a bit small because it's taken from World Health Organization. It's a fairly new, then one of these latest graph that I could actually show, that we could actually see that gallbladder carcinoma is at about 0.56% of cases in Malaysia. So we just cannot disregard gallbladder carcinoma. It is there. It does come. It's one of those many cancer cases that are listed. And these cases are there in Malaysia. So importance of knowing this is there. So let's dive into the clinical presentation of gallbladder carcinoma. So what are the common signs and symptoms? So obviously when we're going to have something to do with gallstones, gallbladder, so we're going to have symptoms like jaundice coming in, the yellowish in your eyes, and then the bloating sensation. We're going to have abdominal pain. We're going to experience, some patients experience weight loss, decreasing appetites, fever, and of course nausea. These are some of those symptoms which are there. Obviously, we can't jump into the conclusion that this could be gallbladder carcinoma, because if we look at differential diagnosis of this, it could be just gallstones. It could be chronic cholelithiasis. It could be some gallbladder stone disease or Hiller bile duct tumor. So there could be many other differentials to this particular presentation, but normally, usually, this is what have been recorded, that such a signs symptoms are present for gallbladder CA. So moving forward, then we should understand something. What very important thing about gallbladder cancer is the types. There are few types of gallbladder cancer. I will be touching on those very common types which are found. Right. So these are called adenocarcinoma. These are layers of the gallbladder's area whereby the cells, the penetration of these cancer cells, where they are determined in the layer of those cells, in this layer of those organ. That's where we would diagnose this cancer as such. So then we have something called papillary adenocarcinoma. So these are at the papillary levels. Then we have adenosquamous carcinoma. So there's a different layer altogether. Squamous cell carcinoma, small cell carcinoma, then something is called as sarcomas. All right. So these are different types of gallbladder cancer which are currently we could differentiate and we could classify them. All right. These gallbladder carcinomas are uncommon, but they are one of the most common primary hepatobiliary carcinomas. They are more common in older patients with long-standing cholelithiasis. So as I mentioned just now, 75 to 98% of all patients with gallbladder cancer have cholelithiasis. And the risk increases with increasing stone size. And incidence increases with age and is more common in female. Right. So moving forward, diagnosing gallbladder carcinoma. So diagnosing gallbladder carcinoma has not been easy over the years. But there have been a few ways to do it so far. So first of all, we'll be looking at what we call as imaging studies. So we have technologies today such as ultrasound abdomen, CT abdomen, and we have something called MRCP, which is called magnetic resonance cholangiopancreatography. So this is a very specialized MRI to look for gallbladder carcinoma. Then we have a surgical option called laparoscopy. And then we do diagnose carcinomas, especially gallbladder, by doing biopsies. So we have ultrasound guided fine needle aspirated. So, and then we will also correspond this with our blood examination. So one of those markers that are quite useful is CA19-9, and another what we call as liver function test, whereby we'll be checking a few of those components in liver function tests. So most of us might not understand what is in the blood test, but actually it has a lot of components of the liver by itself. So different function of a different part of the liver does different functions. So they do have these markers that we could detect and observe and monitor them. So moving forward, treatment options that are available currently for gallbladder carcinoma. So the most common and the most preferred surgical are what we call surgical interventions. They have been quite common, whereby since it has been quite tricky to diagnose gallbladder carcinoma so far. So surgical interventions such as cholecystectomy, whereby they will remove the stones. Then they have what we call extended cholecystectomy, whereby not only the stone, not only the gallbladder, but the surrounding tissues adjacent to the other organs, which is the liver and so forth. And then we have radical gallbladder resection, yes. And then what we have a palliative surgery. This is to have to give patients much more better quality of life. So then, other than surgical interventions, we are looking at other options such as chemotherapy, whereby there are combinations of therapy involved, targeted therapy, and immunotherapy. And of course, the third type is radiation therapy itself. So moving forward, gallbladder carcinomas, if we are looking at prognosis, where factors influencing prognosis, there are a few. It depends on the stage of the presentation itself. And then the extension of surgical resection, the involvement of surgical resection, the size of the tumor, and the nodal size by itself. So I'm due to explain what is TNM staging and TNM classification. So first of all, what is this TNM classification? Well, this staging of gallbladder carcinoma is developed, the stagings are developed by American Joint Committee on Cancer, AJCC. So TNM system stands like this. The T stands for the extent size of the tumor. So the T is the tumor size. The N is the spreading, whether the tumor has spread to the nearby lymph nodes is there. Or, and then the M is the metastasis. It means the spreading of to distant sites of the particular tumor. So that is how we do get a this staging. Obviously, I've already attached a small table to simplify how staging of gallbladder cancer carcinoma is being done. So obviously, as I said, it depends on the factor. The prognosis depends on those factors. It depends on your staging. The earlier staging, the better the chances, the better the prognosis. All right. So let's look at the good part of this TNM classification, long-term outcomes. If you are diagnosed with T1A and T1B, the prognosis is considered excellent. If you have a T2 lesion, it depends on the nodal status. Remember, T2 means it's already spread to the nodes. So, and then it depends whether and then there's this part that is written as radical resection. So sometimes we're going for surgical approach whereby we would want to just remove the gallbladder by itself. So surgical resection or radical resection improves the 5-year survival. And then, of course, the 5-year survival risk for patients with T1, T2, and T3 are okay, are good. And then metastatic disease as presentation. If you have come in and there is a spreading to other organs, of course, then we're looking at a median survival of about 13 months on average. Yeah, maybe more, but yeah, median is 13 months if there is any signs of metastasis involved. So, as I was mentioning about TNM's staging, so first of all, the T stands for tumor size, tumor stage. And then the second thing we're looking at is what we call lymph node involved, where are the lymph nodes involved. And then further down, if it's gone from lymph nodes, then see where they have it metastasized, everything have it spread to other parts of the organ or to any nearby organ near the gallbladder itself. So obviously, if you're talking about metastasis, the spreading of this tumor normally is through the lymphatic system. So that can be quite tricky as well. Moving on. One of the preferred approaches for gallbladder carcinoma have been surgical approaches. So I'll be talking a bit about surgical approaches. When we're talking about surgical approaches, everybody will be getting very scared. You know, wow, just because I'm diagnosed, do I have to undergo the blade? So it depends. So it depends on this criteria whether are you there to be dissected by a surgeon to treat you. So first of all, the criteria should be looking at tumor size, the extent of the invasion, the spreading to the nearby organs, and of course the spreading to the lymph nodes. Because once it gets to your lymphatic system, then things get quite complicated after that. So, and then there are also ways whereby surgical approaches are done using minimal invasive techniques. So some of these techniques have been mentioned before in the slides before this, such as laparoscopy, ultrasound guided fine needle aspirations, MCP, and then minimal invasive surgery. So the therapies available in gallbladder carcinoma. So the role of adjuvant chemotherapy. So there's one of these therapies that I mentioned that there's chemotherapy involved. So this is very important, whereby it prevents the cancer recurrence. It definitely does help in survival rates. And then it targets residual cancer cells. Of course, there are a lot of people who are still hesitant about chemotherapy, but let's look at the positive sides rather than concentrating on the negative part of it, right? So the emerging therapeutic options that are available are immunotherapy advancements, targeted therapies, and then novel combination treatments. So these novel combination treatments are basically more on experiment basis at this moment. So palliative care in gallbladder cancer, those that have metastasis, those that the cancer has spread wider than the organ itself. So the pain management is very important for these patients. What we are looking at is to enhance the remaining quality of life for the patient itself. So this is where emotional support comes in. So we must treat the patient on a daily basis, looking at the symptoms. We should manage the symptoms on a daily basis. And then we should be giving supportive care in terms of mental care, physical care, and emotional care. Why should we be screening gallbladder carcinoma early? As I mentioned during the TNM staging, if you diagnose it early, your chances and your prognosis is better. So the screening methods involved are medical histories and physical exams, or blood tests. There are ample of blood tests, medical screenings, which is widely available throughout Malaysia, either government or private setting, with tumor markers and imaging tests. I mean, we have options to screen ourselves. So please do screen yourselves. We can't be too overconfident about us. So the benefits of early detection, as I said, it increases your treatment options, improved prognosis, and higher survival rates. I've always preferred prevention over cure, no matter what the disease is. So in terms of cancer, I would say we better prevent it. Right. So what do we check in medical histories and physical exams? You might be wondering. So we must be looking at risk factors for you to have a gallbladder cancer. So you must evaluate your symptoms, your abdominal examination, your check for jaundice, your check for your lymph nodes where there are any swellings by doing palpitations. And then there are many other ways to check and do tests. So imaging tests available, X-rays, magnetic fields, guided biopsy needle test. I mean, there are a lot of other imaging tests which are widely available today. So understanding those risk factors. So first of all, if you have very frequent gallstones, it should be, I mean, it raises a cause for concern. Then gallbladder inflammation. Well, bile duct abnormalities, excessive body weight, advanced age, yeah, it does play. And we look at the recent studies, female has more chance of getting gallbladder carcinoma than the male in this sense. And lifestyle factors do influence the risk as well. So maintaining healthy body weight is a must. Being physically active is encouraged, and consuming a healthy diet is a very good step forward to keep yourself disease-free, basically. So we will be looking at diving in a bit on these biopsy techniques. By the way, this picture that I've put on, this is what roughly shows what a fine needle aspiration looks like. I mean, we have put in a needle guided by ultrasound. And then it will go in and take a few small sample. And then we will send the sample over to the lab. And then we'll determine and see what are we looking at. What staging, we will determine the staging before we determine the intervention. So laparoscopic ultrasound is an invasive technique for detailed internal visualization. Then you might be wondering what is an MRCP. Well, there are a lot of imaging techniques available today. So difference between what is MRCP is a magnetic resonance cholangiopancreatography. So it's a non-invasive procedure to scan biliary system by ERCP. That's something called ERCP. Minimally invasive therapeutic intervention, endoscopic. So this is where we do invasive scope to go internally your body to look at the organ directly. Whereas MRCP does it through radio waves, through MRI. Then we have what we call as a PTC and angiography. And then we have what we call as laparoscopic insights. So laparoscopic, as I mentioned to you, is to look directly into the organ, is to do resection, is to do surgical interventions. At times, surgery is also conducted as a prevention in gallbladder carcinoma. What do I mean by surgery as prevention? The consideration here is that once you remove your gallbladder and its nearby infected areas, you're reducing your cancer risk, surgical risk, and post-operative care. So this has been deemed currently more beneficial, more faster, better prognosis in terms of a 5-year lapse, 5-year monitoring. So it has been considered very good as prevention rather than further escalating situation. So as I said, the treatment overview, if you look at the treatment section, it will always suggest you to take surgery as one of the options. Other treatment obviously is chemotherapy, and then we have to do a surveillance for post-treatment monitoring. Usually it's for 5 years, the monitoring. So what determines this prognosis of patients diagnosed with gallbladder carcinoma? Well, its determinants are by genetic characteristics, lifestyle factors, and medical history. It's not so much for genetic characteristics, but yes, lifestyle factors do play a big role today. So the role of early detection and treatment is timely diagnosis crucial. So if you can diagnose it earlier, the chances are much better for you. Treatment effectiveness is the key, and the early intervention improves the outcome. So, what are we going to do to prevent gallbladder carcinoma? Obviously, as I mentioned to you, health, our lifestyle need to change. We need to have a healthy lifestyle. We need to undergo regular exercises. We need to have good nutritious diet. We need to consume none or at least a moderate amount of alcohol. Could at least stop your smoking and vaping and avoid all these second-hand smokes. Obviously, diets also do play a very good part in this. Plant-based foods, avoid your sugars, limit your red meat, and choose whole grain whenever possible. So in terms of physical activity, recommended 30 minutes daily. Yeah. So concluding, in conclusion, taking steps to prevent gallbladder cancer is very important. Changing your lifestyle can lower gallbladder cancer risk. So the most important thing is our lifestyle change. Stress-free life or minimal stress life. And having a good quality life. keeps you away from most of the diseases. So, all right. So we will be, thank you very much. So now we will be going and answering questions that are available. So there's a question from Mr. Hazi Moktazar. She says, "Hi, doctor, how common is gallbladder cancer?" So answering your question, how common is gallbladder cancer? It's not very common in Malaysia. As I said just now, we are looking at numbers of what, 0.86% of cases, overall cancer cases in Malaysia. But if you do get it, it's important that you get it early because the prognosis is good. Even though it's not common, but it doesn't mean it's not dangerous or it's not nasty fellow. Okay, so yeah, answering the question, it's not very common in Malaysia or other parts of the world, but it stands as a very significant factor to carcinoma, hepatobiliary carcinoma, because gallbladder carcinoma is a primary form of hepatobiliary carcinoma. Even though by itself it's uncommon. Okay, so moving on to our next question. This is by Khalid Shahzada. So, hi, Dr. Gurpreet. The question is there any physical sign if someone suffers from gallbladder cancer? Well, as I presented just now, gallbladder cancer is usually diagnosed with a person to a person that had very frequent cases of gallbladder stones. And then a person that has very high intake of alcohol, or the person is immunocompromised, or if you could see signs such as jaundice, abdominal cramping and pain, which mimics gallbladder stones. So yes, gallbladder carcinoma is an evil version of gallbladder stones. So if we could take care of the stones and manage it, yeah. So the physical signs, answering to your question, they are pretty similar to gallbladder stones. So moving on to our next question. This is by Sky Lane Creative. Thank you for your question. So the question is, what is the role of medication in the treatment of gallbladder cancer? Well, if we dive back just now into treatment, the options for treatment is basically if we have immunotherapies. So we can classify a few types of therapies here. Chemotherapy is one of the main therapies that stands today. Obviously, first option for treatment where they suggest, it's been suggested overall, it's surgery. Second option is chemotherapy. So in this chemotherapy, we have a lot of other therapies, immunotherapy, some adjuvant therapy, some novel therapy. Novel therapy is a brand new therapy which is still basically under study. And in terms of medication in the treatment of gallbladder cancer, we are looking at medicating the symptoms. If the patient comes in with abdominal pain, the patient comes in complaining of a jaundice, if the patient complaining of any other gallstone symptoms, the medication involves are basically just to treat the symptoms. So we are looking at that. The other portion of medication is for palliative care, because pain is real, especially in cancer. Pain is real. So managing pain is an utmost priority. So yes, medication do play a role, but in direct treatment of gallbladder cancer, right? So there's another question. Let's dive into that question. This is the final question of the day. So from Mr. Po Ching Tiong. So the question is, hi doctor, can gallbladder abnormality or gallbladder cancer be detected via abdominal ultrasound? Well, if you're talking about a regular abdominal ultrasound, it will be quite tricky or quite hard to see. If we could see gallstones, but if you want to look at the differentiation, usually is we have to undergo a biopsy. Well, there are ways of biopsy. The preferred one is ultrasound guided fine needle aspiration. Put in the needle, take a bunch of cells, we send it to the lab. Then we get to know whether is that a tumor, is that a cancer, or what is the staging of it. Right? So thanks a lot, Po Chin Tiong, for your question, and thanks a lot, everybody, for your attention and for your beautiful questions. I enjoyed giving this talk today, so I hope you have a very, very good day.